And despite years of public health experts warning that the United States was not prepared to handle a respiratory virus pandemic, many doctors and nurses have found themselves without enough personal protection equipment.
So far, the U.S. now making fewer masks and gowns and instead relying on importing items from other countries. Joining us now to talk about the reason for the shortage and its effect on many Americans is Xavier Jones. Thank you for joining us this evening.
Thank you for having us. Thank you for having me.
Why don't you just start by telling us exactly what the situation is right now?
So overall, it's just a national shortage, and I believe that shortage is because of the amount of calls and the amount of people that's actually sick during this time. Obviously, it is unprecedented that I don't think anyone really expected to have this type of event to happen. I think everybody's ramping up and they're using the supplies, which is good to actually keep themselves safe and keep their personnel safe.
Now, you were diagnosed with COVID-19, right?
I was recently.
You were recently. Talk to us about, do you know where you contracted it at all?
No, not really. I'm really around a lot of people. Oftentimes, even with the social distancing, it's just I'm across a lot of people. So I don't really know exactly where it came from, and it's just so widespread that it's really hard to kind of nail down where this type of coronavirus or COVID-19 comes from because it's droplet based.
Can you walk people through what you felt just from the beginning to you look great now. I mean, you look very healthy
absolutely.
now.
We keep hearing about COVID-19
yes,
patients,
so
on death's doorstep. So please tell us how you went through this process and how you so wonderfully recovered.
I am so happy, and I attribute it all to God that I am at this space. But practically speaking, initially I felt flu-like symptoms a few weeks ago. At the early onset, I went to the hospital. They told me it was a sinus infection. They checked for the regular coronavirus, the basic coronavirus. At that time, I did not qualify for COVID-19 testing. They gave me antibiotics. It went away. And after that happened, I ended up feeling fine. And so I went and tested for the antibodies. I said, let me just do this test to see if I actually have the antibodies. Maybe I had coronavirus then. I don't know. Let me just check. And when I went to check, it came back positive. And as a precaution, my doctor told me, he's like, let's just go and do the COVID-19 test to make sure you don't have a viral load right now. And when I went in, I'm like, I feel fine. Feel absolutely fine. I could go running right now. I went, did the tests, and he called me. He's like, how do you feel? I'm like, I feel fine. And when that was over, he's like, you tested positive, so I need you to quarantine yourself and all those things. Although we had already shifted to wearing face masks and all of that, so everyone was protected. It was kind of a shocker, but at the same time, it showed me that we are among people at times that don't necessarily have a look. COVID-19 doesn't have a look, doesn't have a face, doesn't have a socioeconomical standard. And although we thought it was just a call for flu-like symptoms initially, we're finding now that there's more and more people that are asymptomatic.
So what was the antibiotic that you took?
So the initial antibiotic that I took, dicycline, I believe it was, and then the antibody test that I took was a test that's now being tried out now on the market to see if it can detect if your body has fought off the disease before. And that was the test that I took that showed positive.
Wow, interesting.
All right. We're running out of time here, but any words, positive words for folks out there that might be going through what you're going through, if you've already been through?
Absolutely. What I would say is, number one is realize that there is 80-20 rule. 80% of the people are asymptomatic or mild symptomatic. So do not feel that just because a person is not coughing, that they don't have coronavirus, that you can throw a party or have a good time. Treat everyone as if they have coronavirus, maintain social distancing, and it's for the protection of yourself, your family members, and everybody around you.
All right, wonderful advice. Thank you so much for joining us and sharing your story.
Have a great day.